the idea category, and I'll tell you guys when we switch to startup and growth. But the first competitor is Mia Mama. Why do you do it backwards? Did everybody get confused? Like, you want to use this? Mia Mama Fitness.
I don't know, is everyone else going to use it?
No? We'll see how it goes. Okay, start, and I'll stand and give you your 30 seconds.
Well, I am Shauna Cheshire, and I am with Mia Mama Fitness. And I just want you to take a moment and imagine a woman that you love, whether it be your wife or your daughter or a sister or a friend, and she's pregnant, and she's very excited, and she's probably kind of nervous too as she goes in for her first prenatal care appointment. And fortunately, the provider reassures her everything's looking great and healthy so far, which is, of course, a relief. He or she talks to her about the importance of good nutrition, about keeping all the appointments. At some point, your loved one may ask, well, is it important for me to exercise, or is it okay for me to exercise? And hopefully, that provider says something like, well, yes, since you're having no complications, I would actually encourage you to exercise at least 30 minutes a day, moderate intensity, most days of the week. And they may go on to explain all the great health benefits to mom and baby as she does this. And hopefully your loved one's kind of nodding her head as she's taking in all this really great information. Unfortunately though, most providers know that despite giving this little pitch for exercise, only about 1 in 4 women will actually adopt exercise during pregnancy. And they've got to get on to the next patient, so there are any questions, and pretty soon she's walking out of there going, well, what is moderate exercise and what's safe for me to do? And I really want some extra help with this because I sense it's important from what they told me, but I just don't know where to start or how to begin. And maybe the provider's really wishing they had more resources to refer patients like this to, that's so highly specialized for their certain circumstances, because right now they may give a lot of advice like, well, go for walks, and the hospital has a class, I think twice a week, hopefully that might fit your schedule, when they know likely it doesn't. So what if there was a more expansive program to which providers could refer pregnant women to? One that is developed by a certified personal trainer, like myself, who also happens to have 13 years of labor nurse experience, as I do. I am confident that most providers would readily refer patients to such a program. And I really feel that patients under such a program would feel safe and confident knowing that their exercise is being watched over with someone so highly educated and specialized and in pregnancy. I have similar professionals that are ready to be brought on board as soon as I can no longer service the need myself. And eventually I have plans to market and license Mia Mama Fitness to other gyms and trainers so that this kind of expensive, specialized pregnancy exercise programming will be available to more and more women, because this is the link between actually hearing the advice of doctors or midwives to get prenatal exercise and actual adoption of prenatal exercise, because we know right now there are way too many women exercising in pregnancy, and they go on to be inactive and their children inactive as well. Thank you. Yes, lay it on me.
You have a great bedside manner. You must be a nurse.
I do. I speak in soothing tones.
Very well done. Thank you. I had a question relative to kind of the prenatal, the risk to mother as they start that exercise. I know you're a nurse, and I know you have qualifications as a trainer. Is there any additional risk or liability or things that may make this
well, most personal trainers are encouraged to get liability insurance. Just because anyone you work out with could have, could roll an ankle, they could blow a knee, they could get nausea and vomiting and fall over and hit their head. I mean,
start having a baby.
They start having a baby. Their water could break. I wouldn't know what to do. But really, if women are not having any complications, it is much more beneficial for them. If they haven't been active before pregnancy, We don't obviously recommend, and physicians will direct patients in this way. I've actually had a client that I've worked with for about a year now. I started seeing her about 12 weeks along, and we worked through her pregnancy. She worked out with me, I think, 2 days before her water broke and she had her son, and then she started up again about 6 weeks postpartum. So I really have my two loves together that I've really enjoyed it tremendously. And I see there's such a need as a nurse in the hospital. We see more and more, our obesity rates are climbing, and women of childbearing age are no exception. And they're coming in more unfit, physically unfit. And I've seen some very sad outcomes that are a direct result of maternal obesity. So I think it needs to be directly addressed. And these women need to feel safe. I don't know why, but it still perpetuates out there that if you're pregnant, you got to be careful and you can't do anything but walk around the block. And that's not true. And we need to re-educate.
So aside from the risks that you had mentioned, which sound like typical risks for anybody exercising, are there other risks that a pregnant mother could experience? And also, what are the benefits? I'd like to see a little bit more emphasis on why this is important, not only just to eliminate obesity type issues, but how could it benefit you in the pregnancy?
Oh, I love this question. I love this question because we found out that women have lower rates of gestational diabetes in pregnancy if they're exercising. Or if they have gestational diabetes, they do much better, their blood sugar control is much better. They also have lower rates of hypertension, which makes sense because hypertension is usually helped with exercise in the general population. They also, to baby specifically too, we're just finding out more and more about how amazing the benefits are for baby. Babies actually get a training effect from mom's exercise. So as she exercises and works out, her heart rate is elevated. Her baby's heart rate will temporarily go up, as if the baby's working out as well. And what that does is that gives baby a stronger heart muscle, so their heart rate actually does slow, not to a dangerous point. It's actually a healthy lower heart rate, just like you would receive after training for a period of time. And they're actually born with fewer fat cells than babies to moms that are sedentary. And those fat cells you have for life. And hopefully you don't add too much to them, but you can never take them away unless you suck them out, liposuction. There's no natural way of reducing fat cells. You can reduce their size, but you can never eliminate them. And so we've actually found that, there is some good theory out there that perhaps the reason our childhood obesity rates are climbing so steadily is a lot of factors here, but perhaps there's a lot more sedentary moms. And babies may be having a niche against them from the very beginning. So.
That's all we have time for. Thank you.
Thank you.
That's all right. I could go on and on. You have to stop at some point.